Okay, I admit it. I'm a fan of Dr. Pimple Popper. Her videos are so gross, yet I can't look away. I can't stop watching. At first, I started watching for the gross factor, but as I watched more, I started to feel more for the patients who are dealing with terrible skin conditions, including acne. After watching several particularly touching episodes, I started Googling how to become a dermatologist. In doing this research, I learned about the field of dermatology and decided I want to become one. Today, I'm going to share with you a little bit of that research, and maybe a few of you will become interested in becoming a dermatologist yourself. Dermatology is a branch of medicine that diagnoses and treats skin disorders. They specialize in conditions that affect the skin, hair, and nails. According to the Cleveland Clinic, the most common things a dermatologist treats include acne, eczema, psoriasis, skin cancer, nail fungus, and rosacea. Going to see a dermatologist can help you understand your skin and what it needs to get it looking and feeling great. As you can see from this visual aid provided by the American Osteopathic Association, the path to becoming a doctor is a long one. It can take up to 12 years to become a dermatologist. The journey to medical school begins in middle school with good grades. This is important because when you go to high school, you want to take the advanced science classes if you qualify. To qualify, you'll need to have good grades in middle school science classes. It's hard to believe that what you do in the 6th, 7th, and 8th grade can affect the rest of your academic and professional career. It's important that you graduate with very good grades in high school and then head to college. At college, you'll major in something relating to the sciences. Many pre-med students major in things like biology, chemistry, anatomy, and physiology. You must graduate college with excellent grades and do well on the MCAT, the medical school version of the SAT. If you do those things, then you'll probably get into medical school. Once in medical school, you'll have 2 years of classroom work called didactic work, and then a third year of clinical work where you'll rotate through clinics for all different areas of medicine. These rotations could include emergency medicine, obstetrics and gynecology, pediatrics, and many others. During your rotations, you'll become familiar with clinical skills and procedures. Year 4 of medical school, you will submit applications and interviews for different residency programs in dermatology. After you are matched with your residency program, you will graduate from medical school and begin your residency. Residency is when you can begin to work in your specialty area, such as dermatology. You can officially become a dermatologist when you pass your board exam and become board certified, and then the learning doesn't stop. As a physician, you'll always be reading and learning in order to keep up with the latest news in the field. Once you become a dermatologist, you can specialize even more. You could participate in dermatology fellowship. This is a 1-year program where you study very intensely samples of skin, hair, and nails under the microscope to diagnose diseases. Another area of specialization is Mohs micrographic surgery and dermatologic oncology, or Mohs. The Mohs procedure treats skin cancers by removing thin layers of skin, one layer at a time, examining each layer under a microscope, then to see if the cancer remains. The procedure continues until a layer of cancer-free tissue is reached. Learning Mohs is also a 1-year fellowship. Of course, there's also pediatric dermatology, which can be from a 1 to 3-year fellowship, depending on the program. Pediatric patients experience their own unique skin issues, and treatments are different for children than adults. The areas that most interest me is cosmetic dermatology, but not just Botox and fillers. I want to help people deal with acne and other skin conditions like psoriasis, that I can make the patient feel less confident about themselves. Cosmetic derm is a popular path, but many residents choose because it involves helping patients feel better about themselves outwardly by reducing signs of aging and correcting cosmetic defects. And now we've come back circle and we're back with Dr. Pimple Popper. As gross as it can be, Dr. Pimple Popper helps people deal with everything from minor blemishes to major lumps. Her patients arrive feeling embarrassed about their condition, and they leave with a renewed self-esteem. I'm also interested in helping patients with psoriasis because many of my own family members suffer from psoriasis. Did you know that psoriasis is actually an autoimmune disease that manifests itself onto the skin? It's true. It's an overgrowth of skin cells and it's very common, but it can be embarrassing for people who suffer from it. So the next time you see someone suffering from acne or psoriasis or some other skin issue, please have a little sympathy and understanding for them and maybe becoming the next Dr. Pimple Popper yourself.